So you are here today for Reimagining Communication, Navigating Language Shifts while Centering Community Needs. We know that this has been an amazing time. And so we had Natalie present to us last time about how do we use language to engage community members. And now we're at a very interesting time where we want to still engage community members, but the language has been challenged. And so we really want to have this conversation today. I'm going to introduce our speakers and then let them go ahead. And so Natalie has served as president and CEO of Common Health Action, an organization whose mission is to develop people and organizations to produce health through equitable policies, programs, and practices. She has been in that role since 2004. And so for more than 20 years, she's held leadership roles focusing on advancing health through community engagement, institutional change, and public policy. She served as a lead strategist for healthcare systems and public health organizations, facilitated multi-sector community collaboratives, and supported nonprofit boards in adopting equitable and effective policies. She has also created cross-sector leadership development programs and has led professionals like Dr. Washington and I, particularly with the Robert Wood Johnson Foundation's Culture of Health Leaders program. And so these programs are to prepare professionals to build conditions that support optimal health for all. The conversation is going to be facilitated by none other than our Dr. Rodney Washington. He is a visiting professor of early childhood education at Jackson State University, and he is also a co-investigator focused on early care and education at the National African American Child and Family Research Center. His focus is on community engaged research, program evaluation, practical strategies that address social determinants of health across early childhood education and public health systems. And so with that, I am going to turn the floor to Natalie to lead us in the conversation, and I will pull up her slides as she begins.
Thank you so much, Dr. Rollins. Latrice, I appreciate you for being here. And Dr. Washington, I appreciate you for being my partner in crime behind the scenes. And so we'll have a healthy conversation at the end. My hope is that I will talk somewhere between 25 and 30 minutes so that we have a decent amount of time at the end to be able to actually have some dialogue and some conversation. And so I decided to riff a little bit on the title in this for the sake of authenticity and transparency. So we're going to talk about this as reimagining communication, navigating language shifts while centering community needs, expanding our reach, future-proofing the work, righting our wrongs, and preparing for other mess coming our way. That's me saying the quiet part quietly. Next slide. So, good afternoon, everyone, and thank you for being here. Today, we're going to talk about things that are practical and urgent, how we communicate about this work in the current environment and this season. And so, I want to start off by saying I believe that this is a season. And for every season that exists, it changes, and another season is on its way. And so while we have been in a mode of many of us in this work of being reactionary, I also think that we have to put an eye on the future. So I want you to keep that in mind as I start to move through this content and as we have our conversation at the end. Next slide. So what are we doing today? I want to talk a bit about this moment in time, talk about why language matters, how the landscape has changed, and really what is expected of us in this current landscape. I want to talk a little bit about where we got it wrong. And you may find your shoulders creeping up a little bit. It's okay, drop your shoulders, because I think we all got it wrong, right? We just didn't know it at the time. Our good intentions didn't necessarily align with all of our impact. I want to talk about expanding the tent, the shifts that we need to make, the strategies that we can consider, and then let's talk about it a little bit. So let me be clear. Anything that I put out there is for consideration. I don't consider this to be firmed, fixed, concretized in any way. If there's anything that we should have learned, it should have been that we need to be flexible and nimble and to have a mindset of someone who is willing to learn. The other thing is, I don't think that there is one solution for all of the challenges that we face. So as I talk, I encourage you to pull those things that are relevant to you, the things that resonate and feel like they might fit. And the other things, pass them along to somebody else or just leave them behind. Okay, next slide. So I always start off my talks with this idea of where's my mind today? I am not going to lie. Mercury is in retrograde. Everything technological in my life has failed me for the past like 3 weeks. And that includes today. Hence why we were having a bit of a late start, which I expected because, again, Mercury is in retrograde. That being said, the other part of how I'm feeling, next slide, is that we are on a bit of a merry-go-round. I am dizzy from the changes that we have seen in this environment. Now, I am not someone who thought, oh, we've got it all lined up. Everything is in order as it comes to health equity work, as it comes to DEI or EDI, depending on how you say it. But I did think that we had some things that were immovable objects, things that we could count on, that we could point to, that we could put our fingers on. But as time has gone on, I've started to recognize that those things, they are a part of this merry-go-round as well. Next slide. The moment we are in, um, there are legal shifts that are reshaping the field, and I'm going to talk a little bit about those. There's political scrutiny of DEI and health equity work, and we're going to talk a little bit about that. AI is now a part of the equation, whether we expected it, wanted it to, or not. And so the scanning and targeting of language is now a part of our reality, and there are very powerful tools that are being used to do that, and we have to take that into consideration. So the legal shifts that are reshaping what is permissible or perceived as permissible, and perceived is important. I think we need to talk about that. And I think that we have to be prepared for this new future and what it means, because this is a power shift. It's not just about a language shift. Next slide. So the changes that we have here, next, certainly are to DEI and health equity programs. Next. And we've seen it manifest as impacts on certainly government funding, but also that there are some significant differences depending on the state in which you do your work, um, about how some of those impacts are being played out. And so I know, even from my conversations with Dr. Washington, that what he might be experiencing in Mississippi is quite different than what I might be experiencing in Maryland. And I think it's really important that we acknowledge that, right? This is a patchwork, um, uh, in terms of how we are experiencing the changes in the environment to DEI, health equity work, and many of the other things that we do in community based work. Next. So the way that nonprofits are experiencing those changes is it's manifesting in certainly opportunities or a lack thereof. It's also manifesting in what grants are requiring us to do and how we talk about what we do, in our proposals, and as well as based on what funders are asking us to do and not do, right? And so at the same time, it then creates a lot of noise in the environment, and it makes it more difficult to stay focused on a mission that is committed to equity for many of our organizations. Next. The risks associated with it are frankly not just the funding cuts, it's litigation, and it's also reputational risks. Next slide. This means that we are functioning in an environment that the business literature talks about as a VUCA moment, where things are increasingly volatile. They are certainly uncertain. There's a high degree of complexity and a lot of ambiguity. And that ambiguity is fueling how some organizations and some leaders are functioning in the current environment. Next. But in the midst of that, one of the things that is very clear is that words matter. Language really matters. And I think this isn't new because for many of us working in health equity, working in public health, working in spaces where we have been concerned with diversity, equity, and inclusion, we've spent the last 15 to 20 years carefully coalescing around language that was meant to unify us to speak with one voice, right? Next slide. And in that, we, frankly, um, we agonized, we argued about, we memorized, and we evangelized these words. These are the words that over and over again we have talked about, shared, and in many ways incorporated into the fabric of our organizations, our narrative, our messaging. And it was the thing that we tried to use to make our work clearly identifiable, to win supporters, and to open doors for resources to sustain the important efforts that we've been making in communities and throughout the nation. Next slide. But then, in some ways, some things went wrong. And where we went wrong in defining was that we often were making easy terms overly technical in terms of how we defined them. We over-defined concepts and left very little wiggle room around the edges for people to think about and talk about them differently. In some instances, we may even have found ourselves being word police, right? We leaned heavily into identity-centered framing, and it's understandable why we did that, right? I think that we were trying to be precise, but sometimes that precision made our work and made us inaccessible to people. And in some cases, it became easier to misinterpret what we were saying, but also it put a light on the work in a way that has not been helpful to us, and in some instances has now jeopardized our work. So precision sometimes did not work in our favor. Next slide. So why does language matter so much? Next. Language is capital. It is also currency. Next. It establishes relationships. It shapes trust. Next. It influences funding. It signals alignment. And it also signals risk, which we're going to talk about. It matters in all of these ways. And like currency, its value shifts depending on the environment. There was a time when certain terms like equity, DEI, disparities, and equities opened doors to relationships, to partnerships, and to funding, right? To opportunities. They signal alignment, they unlocked funding, they helped to build momentum. In this moment, some of those same words are being interpreted differently. Their value has shifted. And so we then have to shift accordingly. In some contexts, that language is being flagged, it's being questioned, and it's being used to challenge the work itself. So the issue is not whether the work has value. The work maintains its value. The issue is how the language we use is being valued and by whom. Next slide. Some of you may have seen these viral videos that are of Doge staffers in their depositions talking about how they made decisions to cut programming. And Doge used AI to target the work. They had absolutely no way of knowing anything beyond a keyword search that flagged programs because of the language. And with that, then these programs went away. Now, I want to say this, those programs going away was not just about the loss of funding. In some instances, it was the loss of careers, it was the loss of jobs, it was the loss of generational wealth, it was the loss of community capacity, it was the loss of community impact, it was the loss of health, well being, and quality of life. And so, what for them in many ways was an exercise in plugging in keywords into AI, saying, find it so we can cut it, has manifested in a way that has sent shockwaves, certainly through the world, whether people realize it or not. Next slide. And so, in that, I want to lift up something that I think is actually pretty important. And it's brewing, and it's been brewing since 2024. The Wisconsin Institute for Law and Liberty, known as WIL, has filed a federal civil rights complaint under Title VI in the Affordable Care Act against the Cleveland Clinic. Now, mind you, the Cleveland Clinic has been just been named the #3 hospital system in the world, right? So this is very big. The allegation is that Will argues that tailoring health programs to specific racial minorities constitutes illegal discrimination and segregation of medical services. So they have filed suit against the Cleveland Clinic's Minority Men's Health Program and their Minority Stroke Program. So the clinic has responded and maintains that its mission is to care for all people and that these health equity programs are designed to address health disparities for Black and Latino patients. So far, following the complaint, the Minority Men's Health Center webpage that the Cleveland Clinic maintained has been removed, and the U.S. Department of Health and Human Services has opened an investigation. The outcome is still pending because the investigation is ongoing, and the potential for mandated corrections to the programs, if violations are found, is there. At its core, the case is challenging a program designed to address inequities in stroke care. And the argument being made is that the programs that explicitly focus on race may be interpreted as exclusionary under civil rights law. Now, regardless of how the case is decided, what matters is what it signals. It signals that how we design and describe our programs is now under greater legal scrutiny, and it raises really important questions. Not whether inequities and disparities exist, but how are we allowed to talk about them and how are we allowed to respond to them? This case may shape how the future looks for the work that we do. Next slide. So here's the thing. If Will versus Cleveland Clinic becomes precedent, then what? And we need to prepare for what comes next. We have been in a reactionary mode for years now, frankly, based on what's been happening in our society and in the environment around the types of work that we do. If the precedent expands, we're likely to see shifts, such as moving from race-based framing to geography or zip code. And that's real talk. That's not because I'm saying that's what I think should happen or what needs to happen. But if this case moves through the courts and ends up at the Supreme Court, and the Supreme Court says, hey, you're not allowed to have a stroke program that is specifically identified to be for African American men, then it means all of that can be called into question. Now, I can't control for that. We can't control for that. But what we can begin to do is to think about, what does it look like in the future? So this isn't about abandoning the work, and I want to be really clear about that. This is about translating it in a way that allows it to survive and can protect it. Translating is not retreating, but it may be exactly what is required. Next slide. So the landscape is absolutely changing. Next. What we're seeing in various sectors is a shift towards what people are talking about as race neutral or identity neutral framing. Next. And you can go through all of these. There are 4. That shift is happening in all areas. It's happening in workforce development. It's happening in healthcare. It's happening in public health, academia, K through 12 education, nonprofit funding. The shift is happening and we are a part of it, whether we want to be or not. As a result of the shift, programs are being evaluated differently. And I think that that's an important part of this conversation as well. Metrics and how metrics are defined will shift and change in accordance with that. Not just based on what we do, but how what we do is described. So understanding the landscape is critical, not to retreat from the work, but then to navigate that landscape effectively. We must understand how our work is being read. Next slide. So part of the challenge that we're facing that I see nationally is that there is a chilling effect. And what the chilling effect has done is to actually encourage leaders to comply in advance. We saw some of this happen in certain academic institutions where they were not targeted directly, but they saw things happening in the environment, and their general counsel said, hey, we need to pull back. We need to take down websites. We need to change language. We need to step back from being full throated in how we talk about some of these things to protect ourselves. And I think that that has been very understandable. But at the same time, I think that um, it has caused people, institutions, and leaders to pull back from work that communities desperately need at a time when we see the federal infrastructure and landscape of public health shifting and changing dramatically. Um, and we are the backstop to that in the work that we do. Next slide. So I'd like to present to you in a way um, that this is an opportunity. Maybe this is an opportunity for us to expand the tent. Because remember earlier, I talked about by moving into the language the way that we did, leaning into the definitions the way that we did, we shrunk our audience. And a lot of people didn't see ourselves in work that had the word equity associated with it, when in fact, they actually could have been and likely should have been included in that conversation. Next. So I want to pose these questions to you as I continue to talk about where we're headed. Who sees themselves in the work? When you say health equity, who do you think, if you were speaking to a room full of all different types of people, who would think, oh, they're talking about me? And then who would think that's not about me? Because this is important to the conversation that we'll need to have moving forward. Next. In that, it forces us to say who feels excluded. Now, if you rolled your eyes, I get it. I really do. I'm being honest about that, right? And at the same time, I believe in being strategic. And so, folks who feel excluded can choose to engage in what happens next in ways that they are partners and allies, right? Or that they are working against what we are trying to accomplish. Exclusion can be a very dangerous thing. And I think we are learning and seeing a lot of that right now. Next. But within that, also, I want to think of that in a slightly different way and flip it. Language determines participation. If I hear something where the language resonates for me, I am more likely to connect to it and feel like I am about it. Language provokes and it evokes feeling. Feeling is what helps us to get engaged in connection. Connection is what allows us to be in relationship. Relationship is what allows us to collaborate. Collaboration is what allows us to create change. So, language is deeply important to the roots of the change that we hope to see in society. Next slide. So, some recommendations. I think it's time for us to consider how we move from identity to shared experience. A lot of times when we are talking in health equity work, we speak from the place of identity alone, but we don't spend enough time talking about lived experience and shared experiences. That's where stories become really important, right? I think that's the opportunity to increase relatability and to build broader understanding. Next slide. And so, what that means then is that we're moving from definitions to shared understanding. And this is really about considering a different approach, because absent that, we're going to see delays in care, barriers to access, preventable outcomes. Because if people don't see themselves in what we're talking about, if they don't see beyond a definition towards a shared understanding and a shared lived experience, they're not in it with us. We need a critical mass in order to have the power necessary to create change and even to continue the work. And power is the ability to define reality for ourselves and for other people. When we are able to bring people along through our language, we are harnessing the power of community then to create change. Next slide. The other piece that I want to lift up is the opportunity to move from this concept of disparities or inequities to outcomes. The idea that we can shift from focusing on one to the other. really means that we can talk more about what we're trying to achieve, that we are trying to build healthy communities, that we are trying to increase the access to care, that we are trying to ensure that there's economic stability. These are outcomes that most people, I won't say everyone, but most people value. And when we anchor ourselves in shared outcomes, we can expand alignment and we can anchor ourselves in shared goals. Next slide. So, some opportunities to reframe language. What does this look like in practice? And it's not necessarily about replacing language, and I want to be clear about that, but maybe it's a bit more about translating language. So, maybe health equity becomes access to opportunities for health. So, instead of using terminology, we are using the description. Maybe DEI translates from being DEI to being workforce strength and sustainability, right? Maybe calling and labeling populations vulnerable is replaced by saying people who experience vulnerability, and they can experience economic, social, physical, medical vulnerability, right? These are different ways. It doesn't erase the meaning, but it may make it more accessible, more inclusive, and more durable in an environment that's taking swings at it, to be really honest with you, right? So, what's the language that we can create that is more durable? Translation can increase your reach. And that is a really important part of this. Next slide. So, my friend Philip Alberti, who is with AAMC, the American Academy of Medical Colleges, Universities, I always forget what their full title is. He had done this post, and I just thought that it was really helpful. It talks about what health equity is not and what it is. So he says health equity is not about equal health outcomes, but it is about equal opportunity to be healthy. He talks about health equity is not about individual health, but it is about the health of our communities and populations, whether defined by geography or demographics. He says that health equity does not steal health from one community to give it to another. And it's important to pause here. So much of our language was as though we were preaching to the choir, and we didn't get that when we were saying certain things, folks actually took that to mean this is going to steal something from me, right? And so reframing it so that we are able to get people to understand and recognize that health equity does ensure all communities have genuine opportunities. And I'm not going to say to thrive, I want to say to flourish. And let me give you a slight definitional difference in that. To thrive is to do well in circumstances that are not the greatest, but to flourish is to create circumstances where the best outcome is a foregone conclusion. And so, what we are looking for really is for communities to flourish, right? More than thrive, more than beat the odds, more than work against social determinants that are not aligned in a way that produce health, well being, and quality of life. Instead, we are talking about community flourishing in circumstances, in conditions, and in determinants of health that are aligned in such a way that illness, disease, and early death become the anomaly, right? Next slide. And so, with these changes in language, we also have to talk about what does it mean for funding and sustaining the work, right? And I want to encourage you all to do a few things in your grant writing, and it is to be very intentional. Lead with the outcomes. This is what will be true in the world when our work is done, right? Folks know what the problems are when we're writing in our proposals. And so I think this idea of leaning into outcomes, and believe it or not, a lot of people don't do that. I do grant review, and I can tell you it is often missing and it is often buried. The idea of showing the benefit to all. How does this free up capacity or resources for things that other people value? So do this and then you get that. You may not be interested in this. You may not be down with this, but guess what? It's going to get you that. That's what's important to you. That's what you value, right? There's an opportunity in reframing our work in that way. And also look to your funders. Funders are figuring out how to reprioritize their investments in this environment and in this landscape. Some of it I'm not a fan of. Some of it, I'm like, oh, that's kind of slick. That's strategic. I get it, right? Regardless, our work needs the money. So we got to figure it out. So I just want to encourage you, listen, pay attention, even in the RFPs that you see. Read them with a degree of intentionality so that when you are writing to the RFP, you are doing it to be successful, but you're also not sacrificing your commitment and your mission to this work that we define with the word equity. Next slide. It's so funny. I really sat there and said, do I really need to put this in? No, I didn't, because you all don't need to know this because you wrote it yourselves. Use plain language, reflect on lived experience, and build trust, right? These are all foregone conclusions. The problem, though, is sometimes the language doesn't line up. The language does not line up. And I've seen it over and over again. And here's part of the problem, and here's why. Remember the slide before I was talking about how philanthropy, how funders of different types, whether that's federal, state, local government, or foundations, we've got to pay attention to their language and to some degree align and be flexible with that language. In the course of doing that, we end up losing community. We end up losing the currency of language, the capital that we actually need to reach and engage in our communities in ways that are meaningful and impactful. So, this is not an easy thing to do because you're balancing both parts of this equation at the same time. My recommendation to you, and I have been giving this one to communities for years, is to consider how can you engage community members on your team, even down to the point of hiring them, right, to be a part of your team so that on a daily basis, they are making sure there is this translation function and that they hold you accountable for sounding like your community. That's important. Next slide. I want to lift this piece up next is that we have got to get out of this reactionary mode. Okay. And I can tell you, it has felt like I have been running around catching balls dropping from the sky. Some of those balls are rubber balls, and some of those balls are glass balls. And I'm going to be really honest with you all. It can get confusing at times. But I want to encourage you to recognize that we have to differentiate from glass balls and rubber balls. Rubber balls, some of them are just going to have to drop, and I'm going to catch you on the rebound. I'm going to catch you when it comes back up. Okay. Glass balls, we can't afford for them to drop. They're dangerous, right? And they're very, very hard to piece back together again. So, this conversation and organizational strategy and getting out of reactionary mode, it's not just about external communication. And I think this is important. It's about internal language that we need to align. Your team needs to understand how to translate the work, and your organization needs to be proactive in how it communicates. It's about consistency and clarity, not about definitions, but about understanding. So, there are a few things that I would encourage you all to think about in this environment. Next slide. One is that you have to review funding sources and legal obligations to understand if they're going to be subjected to anti-discrimination laws and or local and state politics. Don't assume that because your work hasn't been flagged yet that it won't be flagged. Start looking at your stuff with an eye for these considerations. Also, you have to maybe shift towards thinking and talking about your work from socioeconomic status, talking about it in terms of geography, saying experience based in your criteria as opposed to only saying identity based, right? Next. And it also means that we have to talk about programs in a way that, again, expresses the benefit and the greater good. Next slide. So some things to do, conduct that risk assessment on your programs for these emerging regulations and norms that we're seeing, because some of this stuff is just about norms, you all. There is no actual policy or precedent yet, but we're being sucked into a vortex of being compliant in advance. Stay informed about the legal changes. Keep an eye on the horizon because things are shifting and changing quickly. Make sure you're having the conversation about your internal commitment to community and equity principles associated with it and how you want to talk about that. Diversify funding, you all already know that. We can go to the next slide. Reframe DEI, if you're talking about that, reposition it. And so it becomes part of other things. It's a part of innovation, it's a part of effectiveness, right? Engage in coalition building in a way that helps to make the risk more diffuse, maintain the adaptability and the flexibility, and have contingency plans for the work that might be attacked because of the language, right? Next slide. So, some final thoughts before we open it up. I think, next slide, our organizations have to think about this as a translation era, that the work doesn't stop. The mission doesn't change. Next, next, and next. Um, the work continues. The language is going to have to evolve. Um, Audience engagement and impacts can expand. There is an opportunity right now for us to lift the veil off of how we talk about what we do in a way that makes it more accessible and more impactful, right? Next slide. And so the question that I want to lift up as we go into a Q&A, what expands the tent? What builds understanding and what protects the work? What's the new language that we need to see and hear to engage people in ways that they've never been engaged before? How do we speak to the people who traditionally, when we walk into rooms and we say health equity, don't know what it has to do with them? How do we talk about issues of diversity, equity, and inclusion in a way that doesn't open it up to being weaponized by certain people, but rather so that they can then understand the benefit of that? And so, with that, I want to open it up and we can stop sharing slides. Um, and I want to open it up to questions and to comments. Was there, I'm going to hand it off to Dr. Washington actually and see if you want to go ahead and lead us into it.
Yes, Natalie, that's I'm still on the eye roll slide because my eyes were rolling. Um, I I get the logic in a great in all these, but I do want you to revisit some of these other pieces. Like
Mhm.
I think where I want to start is when you spoke about, because I was over here writing, I got a whole page of notes over here, and
Okay.
so I feel like I've been in a full-on lecture and it's great information, but I do want you to revisit that slide that talked about expanding the tent,
Yes.
right?
Hmm.
And who sees themselves in the work and who feels
Hmm.
excluded. Can we go back to that? Can we talk
Yeah,
about that a little bit?
I'm going to. Yeah.
Because I'm a bit sensitive to that. And I'm
Yep.
glad the disclaimer already happened because some of these are going to be my views and my views only, right?
Okay.
But can we talk about, who does feel excluded? I mean, who
Yeah.
is that, right? Because
Yeah.
I think that there are lots of communities that have always felt excluded, and these opportunities have allowed them to be seen and valued,
Yeah.
right? Where they were not. So can we talk about that dance a little bit more for the audience to understand it?
Yeah. So here's what I'm learning, and this is, and I've been in front of some tough audiences the past few years throughout the country, and Q&A in some of those rooms has been tough, and people have lifted up in those audiences that those of us who have been doing the work of health equity and DEI have done very little to acknowledge or engage the experiences, the lived experiences of poor white people. And then in
Mm,
doing that, we have missed a swath of the country that could have been engaged in this work so that our numbers would have been bigger. And I'm going to say part of the strategy, I think, for some folks is to, of course, make it so that rurality is so small and inconsequential that we didn't even see the value of being very open and explicit about the inclusion of that when we were talking about health equity.
Yeah.
And how do I know this? Part of how I know this is I was writing an article, a paper, right? And I went in search of data that could lift up health inequities coming out of rural communities. But more than that, I drilled down and I said, when you think about white people living in poverty throughout the country, can you show me health inequity data? It was incredibly difficult to find. So if you were looking at Chicago, for instance, and you wanted to know how do health inequities manifest in inner city Chicago for white people who actually do live there, there's next to nothing. So that's an example when I say who doesn't see themselves in a work in terms of who feels excluded. That's the message that I've gotten when I've been out in the field. I'm going to be honest with you. I wasn't thinking about it. I wasn't thinking about it, right? And so it's been difficult because the eye roll piece, right? That's
Yeah, because I look at it another way though. I see it as a lot of that data is I posit that a lot of that data may not be available because there's a effort not to share that narrative happening with that population, right? Those kinds of data points have always been used to shed a light on communities of color, right? And so those data points that are out there that are missing for white populations, I'm thinking that there could be some intentionality around that we may not be exactly responsible for. And I'm talking about the folk that's doing the work.
I take no responsibility for it, and I don't think that you all should either, right?
Okay.
And so no.
Okay.
Absolutely. I don't think that this is about us taking responsibility for the fact that it's not there and it doesn't exist. I'm talking about the impact of it, though. The impact of it, regardless of the forces that may be in play for why it doesn't exist, that's the issue. The impact of it is people not seeing themselves in the work. Their elected officials not seeing themselves in the work. The funders who are concerned with that not seeing our work as being about that. And so it gets in the way of resource and support and protection at a time when we absolutely need it.
I want to read this comment that we have a question in the chat. So this is from Natasha. I'm still trying to figure out my public and sustainable way forward in this moment, these circumstances. And I realize that there is not just one path forward. We will each take different paths and risks. I think this is necessary. My question, could you speak to past historical movements that have had a negative similar that have had to navigate similar factors and various pluralistic ways that they've moved forward?
I think probably what I think
Mr. Lacey
probably
wants to come off mute.
I think it the first thing that popped into my mind was the suffrage movement. And I think this idea of when white women were seeking to get the vote, and the idea of where were Black women in the midst of that, and how do we see that then play out? That's the thing that kind of came to mind for me. But Natasha, I'm actually can Natasha unmute? Is that possible?
Yes.
Because I want you to explain even more about what you're asking in this question. Is it possible
Natasha,
for
are you able to unmute? If not, we can put.
No, I have to do
Okay.
it. Give me a moment.
Okay. I'm sorry.
Let me find her name. And should be able to come on. Okay. All right, Natasha, you can unmute.
Thank you. And I will try to put these into succinct words. I'm just thinking, listening to you is really helpful. And also I'm thinking but don't some of us still need to maintain some of the language? Like some people might divert and translate,
Mhm.
but then, and I know it's not just the language, I know it's,
Mhm.
but like imagine if suddenly I was told I couldn't call myself Black and needed
Mhm.
to come up with something else, then it's like, no, I'm Black and I'm proud, and that's not going to change.
Mhm.
And so I'm wondering, in looking at history, I know there's so many examples of like there are different paths forward people took, and I'm wondering if you could speak to an example where it's like, okay, some translated to like um, build more understanding and belonging and all of that, and others like took the path of we're sticking to this, but how they work kind of together. These pluralistic ways work together to actually create change. That's my
Yeah.
question.
I think that there are some things that are immovable objects, right? And so, as you said, me being Black and me being a woman are immovable objects as far as I'm concerned. But what I think is when I frame some of the challenges that I face in certain audiences, I focus on the experience that I'm having rather than the identity that is the driving force behind the experience. And so if I am making the case, for instance, that I am being paid less, right? It is the conversation about the pay inequity that I'm leading with, not that I am a Black woman who is paid less. I am being paid less and then opening that conversation. Now, here's the thing. Once I've captured the audience by talking about the inequity in pay, then I can drill down and say, and here's what are the driving factors behind that. But when I lead with, this is the driving factor of what I'm experiencing, I don't even get their ear. I don't even get to have a conversation. I don't even get a moment, right? I don't have the opportunity to engage. And I'm not saying that that is a perfect fit for every conversation every time, but it is a strategy that has worked for me. And let me be even clearer. There's never a time that I'm not me. And so I'm going to tell the truth, but how I organize the truth is different based on the audience. So the language I lead with, right, is not necessarily the language that I actually leave with. And I hope
Mhm.
that makes sense to y'all.
Yeah, I love that. And thank you, Natasha, because yeah, I think we're on the same page. I think we're gonna go to that was
No, no, you can go on with any
okay,
questions. He had to leave.
okay, okay. But so I want to get this. Maybe this is the final because I know we're at time, but this is a
Yeah.
great conversation. But here's what I want to ask you, Natalie, to for those of us who and I love that you talk about the identity piece in this because some of us are very close to this work and it shows up in that way.
Mhm.
But also, is it a risk calculation that you make? Let's say that you start to redefine, do the risk assessment, change all your language, scrub all your web pages, and then
Mhm.
things shift. And then they
Yep.
say, oh, this language is fine again. Have
Yeah.
you lost social capital
Yeah.
with the folk that trust you to share their stories and amplify their narratives and all of that? Like, what if things shift back to, oh, it's okay to now say all of these things again?
But Rodney, this is the thing that, okay, Dr. Washington just became Rodney.
Rodney,
But
yeah.
Rodney, look, listen. The thing for me is this, right? If I'm explaining health in one room and I want to create understanding, I may use the World Health Organization's definition of health. But if I'm going over to my neighbor's house across the street to help them to understand health, I'm not touching the World Health Organization's definition. The
Mm-hmm.
point being, the goal is to create understanding. How I do that in different rooms and different audiences requires me to be multilingual in a sense, right?
Mm-hmm.
This isn't about the website per se.
Mm-hmm.
Your website is supposed to be like a kind of like a median, enough to catch enough of this and enough to catch enough of that. But it
Mm-hmm.
doesn't really breathe life into the work for people who have never seen it, heard it, and don't know about it, right? The
Yeah.
key is the translation muscle. the ability to create understanding regardless of audience while still maintaining fidelity to the intent. And so for me, having to have worked in communities with very, very different socioeconomic status, very, very, very different demographics, means that I have to be able to translate regularly in real time while still being authentic and committed to the truth.
Okay.
Right. And it
Okay.
requires practice. You get better at it over time. I believe I've gotten better at it over time. It's why in Q&A in front of an audience of 1,000 people, and somebody gets up and asks me, quite frankly, what is intended to be a nuclear question, right? That I've been able to navigate it while still telling the truth. Because in my mind's eye, if I do anything other than telling the truth, it's going to happen at the moment when somebody has their cell phone up and they're recording me. And so I've got to tell the truth because I never want it to come back as though Natalie Burke said something that was disingenuous about the work. I'm not doing that, but I will translate so that people get understanding. And that has to be the focus of the language. And I hope that's addressing what you're talking about, Rodney. It's translation and understanding.
I want to read Martha's statement and then we'll get ready to do closing thoughts around this. As a local public health agency, we have found ourselves changing our language to align with individual grant requirements or with select groups. But as an agency overall, we haven't collectively changed our approach to talking about EDI, health equity, or racism. Should we continue to be flexible based on the groups and or grants?
I would say that the answer has to be yes. I don't know that you have an alternative, but there has to be, Martha, I think there has to be a guiding star, so to speak, something that is rooting you so that you don't lose your way. You can't be a ball bouncing in the waves with nothing anchoring you. That's not going to work, right? But I do think that's the other piece that's important. Language evolves. You know, when some people and some people who might even be on a call are here, they might have been Negro. There were folks who became colored. Then I think I was Afro-American. Then I think I was black before Afro-American, and then I think became African. Listen, um, it is the evolution of language that I think we are all called to be a part of, because I think we can inform the language as well. We don't have to just be subjected to it. But I also think that we have to be nimble and flexible enough to create understanding, translate it, but stay rooted and framed in our core values about this work.
I appreciate it, Natalie. I think this is great information. I think the takeaway for me is, the identity-centered framing, moving away from over-defining was an important piece. Thriving versus flourishing was another important piece. There was just a lot of outcome framing in talking about the work. And so my concern is always bringing the community along with us as we do these things. And I think you touched on a lot of very great avenues and approaches for us to do that and kind of remove ourselves a bit more from all those pieces. So thank you very much for this informative presentation.
And thank you for the provocative question to kick it off, Dr. Washington.
I could go. I got about 4 more, but we're at time.
I can only imagine.
Let's just argue.
I know, right?
Yeah. So I'll turn it back over to Dr. Rollins.
Awesome. Yes. Thank you so much, Natalie, for again giving us so much to think about as we continue in this very important work. And I definitely echo Dr. Washington's sentiments that we have to take the community along with us, and that, these words matter, but the outcomes, that's what we need to be focusing on, and shared experiences. I love that. And so thank you all so much for hanging in here with us. As I've shared with you all in the chat, this recording will be on our website. So feel free to refer back to it, share it, and all of those things as we all continue to do the great work. And if you are inclined, you can watch the previous webinar that Natalie did that talks about language to engage communities. I think it still applies, right? So thank you all again, and we will be in touch.
Thanks, everybody. Thanks for having me.
Of course. Bye-bye, everyone.
All right.